Good afternoon, and thank you for joining us in our Q&A session titled, When Your Baby is in the NICU, Centering on Connection and Finding Support During COVID-19, funded by the New Jersey Department of Health. My name is Yvelisse Gonzalez, Perinatal Mental Health Coordinator at the Partnership for Maternal and Child Health of Northern New Jersey. For those of you who are unaware of our organization, we are a nonprofit committed to improving the health of women, children, and families. I encourage you to visit our website at www.partnershipmch.org to learn more about the different programs that the partnership provides and see which ones are available in the areas you work and live in. At the conclusion of this Q&A, I will talk in a little bit more detail about the program that I work in, the Perinatal Mood Disorders Initiative. In today's discussion, we will be talking with Suzanne Bryjak about tools to relieve anxiety, finding peer support programs, and emotional connection activities while having a baby in the NICU. Suzanne Bryjak has been a neonatal intensive care nurse for over 20 years. She has developed family support programming in several New Jersey hospitals, developing parent advisory councils with an emphasis on strengthening parent and staff education, on successfully supporting NICU families. She holds a board certification in holistic nursing and is co-creator of Visionary Healing, incorporating holistic care and integrative modalities in the NICU, which looks at stress reduction modalities for family and staff to incorporate improved outcomes. Suzanne's current work as a nurture specialist includes helping families in the NICU establish and strengthen emotional connection, as well as directing nurture specialist training initiatives for the Nurture Science program at Columbia University in New York. Having a baby in the NICU can be very stressful, especially when you're having one during the time of COVID-19. So Suzanne, I thank you so much for taking the time to meet with us today and to talk to all of these moms out there. And for all of you moms and professionals out there, I thank you for taking the time for tuning in. I ask that you use the chat box to type your questions in to the right. And depending on the amount of time we have, we'll try to get through as many as possible. Okay, thank you, Susan. Take it away.
Sure. Thank you so much, Evie, and thank you to the partnership for having me here today. I'm so happy to be talking with you all. So it's humbling to hear that bio and hear these things about yourself. But one of the most important pieces of my identity is actually left out of the bio that I want to share with you. I would say two important pieces. So you talked about the fact that I was a NICU, that I am a NICU nurse, once a NICU nurse, always a NICU nurse for over 20 years. And that is really, really impactful for me. But what really fuels my passion for this work is the fact that my son was in an ICU for many, many months in the first year of his life. And it really changed the way that I practiced and the way that I thought about how we should be supporting moms and babies in NICU. I went back to that practice with post-traumatic stress myself and really looking with a new lens at how we were caring for them, and worked with multiple programs, wonderful programs through the years. Currently, my work is with the Nurture Science program, and I want to just talk a little bit about what we do at the Nurture Science program in Columbia University, because I feel very strongly that what we're talking about when we talk about moms and babies being close in NICU, for years we talked about it through bonding, we talked about attachment, but really what we are moving toward is talking about emotional connection. We want babies and moms to be emotionally connected. And we know that this time during COVID has been really challenging, but the message I want to send today is that you absolutely can still reach an emotional connection, even if your time together is limited. So this first slide talks about our framework it's called calming cycle theory, and it was developed by Dr. Martha Welch in the Nurture Science program. The primary, what we call intervention in the Nurture Science program is emotional expression. And what makes it different from other programs, I believe, is that you'll see this circle of activities. So family support, holding and touching, eye contact, smelling, singing and talking, crying and upset and listening. And all of these things are activities that, and I'm calling them activities, but they're all components of what moms and babies or parents and babies, let's say, in NICU experience. But the key ingredient in the family nurture intervention through Nurture Science is that we want an emotional expression through all of that. And what I want to talk about a little bit today, what we're going to talk about later on, is how you can embed these activities and this emotional expression even at a distance. So through the Nurture Science program and our calming cycle theory, we've found that when our parents are emotionally connected, when our parents use these activities and emotionally express, two things happen. Number one, they emotionally connect. So if you look over to the left and you see that heart to heart, parent, this is mom to baby, but it's parent to baby, that emotional connection that they're feeling, that is one outcome. The second outcome is autonomic co-regulation, which is, I know, a sciencey kind of term, but I'm going to kind of try to simplify it for you, because I talk to parents all the time and I go to them and I say this simple. So when you're separated from your baby and your baby is maybe in the isolette and crying, or you're separated and sitting next to the isolette. So it doesn't matter if you're in different buildings, or you could be right next to each other, but you could still feel separated. But once you start to talk to your baby, once you start to think emotionally about your baby, and once your baby looks over at you or hears your voice, what happens? And the moms say, oh, my heart rate comes down. We start breathing in sync. We start feeling better. Mom's blood pressure comes down. Baby stops having, different changes in their physiology. And every parent seems to know this, but we have proven it now through science, through Nurture Science. So number one, heart to heart, emotional connection. Number two, better physiology. Your health is better. Mom's health, baby's health, and I'm sure dad's health too. We're going to get to that research. So I just want to go over some of our research results that have been published. So this is our infant outcome summary through the Nurture Science program. And what we showed at term age, our babies through serial EEGs had more mature brain functioning. They had improved firing in the frontal part of the brain, which we know controls executive functioning and makes us kind of who we are. We also had decreased, or I should say increased, maternal infant engagement. So our moms were more engaged with caring for their babies. At 18 months on the Bailey's exam, they had improved social relatedness, language, cognition, attention, and decreased risk for autism. And why was this so important? Because we saw those results very early on. We saw them in NICU at term, and we saw them at 4 months, but we were wondering, does this trajectory actually carry out? And it does. We had two groups in our randomized controlled trial. We had standard care, and then we also had babies who went through intervention. Those babies who went through intervention all the way up to 4 years had improved outcomes. And what was the crux of all of that? It was emotional connection between mom and baby. So you could go to the next slide. And this is mom. And so when baby's feeling better, mom's feeling better. When mom's feeling better, baby's feeling better. This is that reciprocity that happens between mom and baby. And we saw better caregiving behaviors in NICU. We saw a decrease in depression and anxiety, which we know is so prevalent in our NICU moms. So to see that was a really profound finding. And then we found better physiological regulation all the way out to 4 and 5 years in mom as well. So I just wanted to share some of those research results, and that this work is really founded deeply in science. You can go to the next slide. We'll come back to this at the end, some of these resources. But so perfect.
Okay. So Suzanne, thank you so much for that information. It was wonderful. Thank you. So I have a couple of questions for you. So with restricted visitation currently in place in the NICU, what are some concrete ways a mom can connect with her baby while they are physically apart?
Yeah, thank you for asking that. So first, I just want to address visitation very briefly, because I know that there are different participants here from different area hospitals, and our visitation in our NICUs are all very different. First, visitation in NICUs historically has been very different, and now with COVID, it is even more so, primarily because COVID is affecting different areas in different ways, and we're really still trying to figure out what the safest practices are. So what I would implore everybody to do is be as patient as possible with your healthcare providers. Everyone is trying to do the best they can, and their goal really is to get you to be together with your baby as much as possible. But when you can't be in the unit with your baby, there still are activities that you can do. We talked a little bit, and I'm going to give you a few. We talked a little bit about that emotional expression. One of the most beautiful ways to feel connected to your baby is to actually do an emotional expression journal, to actually do an audio journal. And so you can use your iPhone or whatever phone you may have, any type of recorder. And it's a wonderful thing that you have that you can share with your baby for years and years to come.
Yeah.
And there are wonderful prompts that have been created by Dr. Welch in our Nurture Science program. Some things that may evoke some emotion, that you can talk to your baby about the things that have been hard. We know that this experience in NICU is not an easy one. No one has the goal of having a baby in NICU. And so with that comes many emotions. And so it's okay. It's actually really, really good for you to express the things that maybe are upsetting you, the things that you're worried about. But then also talking about all the things that are going wonderful, and the things that you see, things like, oh, I notice you have daddy's toes. You and daddy have the same toes, and talking about that. Talking about maybe siblings at home that are waiting for baby to come home. Talking about how you give baby their name. And these audio journals help you get through, help you feel closer when you're separated, and then you can share them with your baby later on. And some NICUs may even let you share some of these recordings with baby when you're not there, but I would refer to your healthcare provider for that. There are other activities, things like the scent cloth. Our scent cloths, mom would sleep with a scent cloth at night. Baby puts the scent cloth under his or her head. And then when you do come in, you exchange. Oh. And again, you can refer to your healthcare provider as long as you're not coughing and sneezing on this cloth. They're known to be very safe, but I will always defer to the healthcare team at your hospital to see. If you only want to do a one-way cloth, some of the parents I work with only want to do a one-way cloth from baby to mom. That's fine too. What I want to emphasize is you want to do whatever you can to connect with your baby, but also decrease your own anxiety. So holding that cloth, smelling your baby when you're at home, and not just smelling, but imagining what it's like to hold your baby, imagining what it's going to be like to when you're with your baby the next day or the day after that.
Oh, those are such great ways, beautiful ways for, mom, dad, and baby to stay connected. So another question is, how can mom safely make the most of the limited time she's able to spend with her baby?
Yeah. So we just talked about what to do when you're not with baby, but when you are with baby, it is so important that it is not the quantity of time, it is the quality of time that you spend with your child. And so one of the really wonderful activities that many of you may be familiar with or have experienced is skin to skin. Putting, whenever medically possible, to take the baby out and put the baby up against your skin and experience that skin to skin kangaroo care is so very important. However, there's a huge difference between putting your baby in the kangaroo care and then being on your phone or talking to the healthcare providers or even just daydreaming or thinking about the things you need to do in your day. I would implore you again, when you're in skin to skin with your baby, talk to your baby, be present, be mindfully present with your baby.
Oh, that's wonderful. And in being physically separated from the baby for such an extended period of time, is it bad for his or her development?
Mm. So this is really the question I get over and over again from parents. And again, I want to reinforce the message of quality of time over quantity of time.
Yeah.
What we found in our research results did not take a lot of time for our parents to do. They were in the unit for a limited amount of time, even before COVID. So very important for you to recognize that, yes, you may have a limited amount of time, but if you make the most of that time, it is not going to affect the development of your baby.
And how can mom integrate other family members into her baby's daily life while complying with the restricted visitation and social distancing?
So we know that having a baby in NICU does not only impact the parents, right? It
Yeah.
impacts the entire extended family. There may be siblings at home. Integrating siblings is really important. Some of the things we do in our units is we have the siblings draw pictures, and we would then put those pictures up on the baby's isolette or crib and take
Oh,
photographs. And then you bring those photographs home to the sibs and you say, look, baby has your picture and he loves your pictures. Make photo albums for the siblings at home, make photo albums for grandparents. But most importantly, figure out what it is that your family members, your extended family members and friends, what they do really well and what they want to do for you. And I'll give you an example. A tool we use through, again, through the Nurture Science Program and Family Nurture Intervention, it's called the Family Support Circle. And so what we do is we have our parents look at everyone in their support circle and rate them on a scale of 1 to 5 for helpfulness and availability. And so the reason why this is helpful is because you may have someone who is always there, right? Always there for you, knocking at the door, that neighbor, I'm here to help, I'm here to help. But they're really not helpful in an emotional way, but you can give them tangible things to do for you. You can give them your laundry. You can give them things like that to do. But then you may have this sister who lives out in California. She's really not available, or even people now during the time of COVID, everybody is having to be socially distant. But you want to make the most of your time with those people and get their emotional support through things like Zoom and FaceTime and Skype. And we're all becoming very well versed in these
Absolutely.
in these ways of connecting. But again, really trying to figure out where people can be helpful. I had one mom who just couldn't figure out how to connect with her in-laws, and it had been a long-standing problem before baby was in NICU. But one thing she really loved was her mother-in-law's cooking. And I said, well, what would it feel like if you talked to mom-in-law, and said, you know, I would love, can you just make me a tray of lasagna? And when she did that, it just changed the whole relationship. They just want to be able to do something for you.
Yeah. It's like looking at your circle of people that you surround yourself with and picking and choosing what need they're going to be able to meet while you're going through this time, it sounds like.
Precise.
So is there anything that the NICU staff can do to support baby emotionally and developmentally when mom can't be there?
Absolutely. So I want to start with how the NICU staff can support mom. And the number one thing before COVID and now with COVID is communication. Fluid communication with the NICU staff is so very important. So I would ask that healthcare providers in the NICU have a very streamlined way of communicating with families, even during this time, utilizing things like text and programs that may be available to individual hospitals. But what else can NICU providers do besides communicating with mom? They can actually emotionally communicate with the babies as well. You know, when they're doing their cares for their babies, talk gently to the babies. Give them non-procedural touch when they can. Those things are so very important.
Oh, that's wonderful. And what kind of support programs are available to mom and her family?
So there are lots, and if you want to pull up the slide, the last slide again, we have lots and lots of resources. So first, I would tell you, get in touch with your social work team or your family support team in your individual hospital. So many NICUs now have very strong family support programs. Many use the March of Dimes support program, which is a fabulous program, utilizing peer support. Even if it's not a March of Dimes program, many hospitals have a peer support network. And it's so important to be able to talk to somebody who's been through this before, who's been in your shoes. It really makes you feel like you're going to be able to get through whatever comes. So I would tell you to reach out to your hospital for those things. Up on the slide, I have a parent-to-parent buddy program and also a mom support program that's offered through the Valley Hospital in Ridgewood on Tuesday evenings. And there are emails and numbers for Erin Smith, who's the contact there. But again, much more convenient if you can do it through your own hospital. I've talked a lot about the Nurture Science program. Our contacts are there, and we're also offering some online support. But there are wonderful national organizations, and I can't say enough about Hand to Hold. www.handtohold.org is offering online peer support through a national network. They're also offering support to NICU healthcare workers during this time. So that's important to know. And then the March of Dimes, they have an app called My NICU Baby, which is wonderful, and you can track different milestones with your baby through that app. And then also they have online Share Your Story, where you can share your story. One of the things that is, I would say, a very prevalent theme, whether we're talking about March of Dimes, NICU Family Support, Hand to Hold, the Nurture Science program, is that when you're going through this really, really intense situation of having your baby in NICU, you need to share your story. And so sharing, March of Dimes has a great site where you can share that story with other peers who are going through it as well. And then going back to Nurture Science, share that story with your baby. There's no one better to share that story with than your baby, who wants to hear your voice, and your voice actually helps rewire their brain for better developmental trajectory.
Absolutely.
Yeah.
Can be very therapeutic and cathartic for the mom. I can see
Absolutely.
that by doing that. So before I get to my last question, I just want to remind anyone who's watching to please use the chat box and feel free to ask whatever question you want to ask of Suzanne, because we definitely will have time at the end. Okay, so my last question is, when a mom, what do you do when you have a mom who's feeling very anxious and fearful a lot of the time when she has the baby in the NICU? Like, is that normal? And what are some tips of things that she can do to help alleviate those feelings?
Yeah. So first and foremost, it is absolutely normal. I always say to moms that it's the mom who isn't anxious at all and doesn't cry at all that I worry about. You know, I worry about those moms who don't allow themselves to feel what's happening. It's okay to cry. It's encouraged to cry. You can cry when you're with your baby. It is not going to negatively impact your baby. We promise. We have learned that through science. But we also worry when mom can't stop crying. We don't want a mom who can't stop crying. So what we want to do is kind of keep you somewhere like everything balanced in the middle. And this is where my holistic nursing practice kind of comes in, because we just want to maintain a healthy balance. You're going to have your up days, you're going to have your down days. That NICU is like a roller coaster ride in many, many ways, but just trying to keep yourself as even as possible. And there are wonderful ways and practices to help you do that. There's a great website called headspace.com where you can find wonderful meditation. And you meditate as a mom, dad, caregiver. Our healthcare workers are going through so much right now. So I would encourage everyone to use those apps that use meditation. Now, some people have an aversion to meditation because they think of it as that having to sit cross-legged with your arms out here and you know, control your breathing. But that's not the only kind of meditation out there. There's guided meditation where you're kind of envisioning yourself out on the beach, and we all need that at this point. So I would highly encourage utilizing guided meditation, laying down in the most comfortable position. You don't need to be uncomfortable.
Thank you. So we're just going to get to some questions from some of our participants. So I know that each hospital is different, but what is the average amount of time per day that a mom would be able to spend visiting her baby in the NICU?
So average amount of time per day during COVID is very variable. So
Okay.
that is really specific to the area you're in, how much they're seeing currently in that area, in that hospital. So it's very different. Before COVID, there were even I would say inconsistencies in how many hours parents were to spend with their baby. And every baby is different. You have
Yeah.
also look at what the condition of the baby is. Another thing I neglected to say before that I want to make sure I get in is, even if your baby cannot come out for skin to skin or to be held, there are wonderful ways to connect with your baby while they are in the isolette or in the crib. And I would encourage little things, just like bringing the isolette to your eye level so that your baby is eye to eye with you and they can see you. Opening up those portholes. It's amazing how those first few days for parents, we don't even know. And I say we as parent and nurse, so forgive me with the we. It depends on who I'm playing at the moment. But parents don't even know that we can open these portholes. Open up those portholes, talk to your baby. So there's lots of ways to connect even while baby is in the isolette. But how much time? That's really variable depending on your baby's condition, depending on what's going on in your hospital presently. But what I would say is, again, quality of time. Quality of time.
So it's like making the most of the time when you're there, regardless of how small that may be.
That's exactly it.
So what kinds of questions should a mom be asking the NICU nurse and doctors if the baby has to be in the NICU?
Yeah. So first of all, it's really important to speak to your healthcare providers and let them know what kind of learner and communicator you are.
Yeah.
And it's something, as speaking to the healthcare population, to the healthcare provider population, that we as nurses now and doctors should be asking our parents, how do you like to communicate? How much detail do you like? And as if that isn't happening, then you tell, as the parent, you tell your healthcare providers. I'm a person who wants all the details. No matter what happens, give me a call, give me the details. Or maybe I'm a person, just hit the highlights with me. All the details send me into feelings that I just can't do right now. So explain that. And so you let them know what you need. There are daily rounds with physicians and the healthcare team each morning. If you want to participate in those healthcare rounds as a parent, that is a wonderful thing. Ask your NICU if parents are allowed to participate in NICU rounds. And even if you can't be in the unit at that time, you can try to use some sort of Zoom or FaceTime or something like that. Or even just be on the telephone. Just be on the telephone, because your input as a parent is so very, very important. You may see things that are very important things that for the healthcare providers to know.
Thank you. And another question, how do lactation consultants work with moms while baby is in the NICU?
How do lactation consultants work with moms? So some NICUs have a dedicated lactation consultant, so that person would be more readily available. Other NICUs utilize a lactation consultant that is shared between the mother-baby departments, the well-baby departments, and the pediatric departments. So what you would do then is tell your nurse that you want a lactation consultant to see you, and they would set up an appointment, a time. So depending on your NICU, but again, always ask your NICU team, your physicians, your nurses, what does this hospital offer? Does this hospital have someone available now? Do I need to make an appointment? Some hospitals have what they call a hotline or a warm line where you can actually call. They'll give you phone calls back. So there's multiple ways to get involved, to get attention from the lactation team, absolutely.
And does the lactation team provide pumps?
So Every hospital should have pumps available for you to pump when in the hospital, but at home, that's really specific to insurance and different things like that. But that's where you would really want to work with your social work team, your discharge planners, so that you can make sure most moms in NICU can receive some sort of pump, and you should be receiving some sort of pump. So work with your team on that.
Awesome. Another question is, thank you for sharing the voice notes as a way to connect with baby. It is a great tip for parents. Are there any websites that provide examples of the voice notes?
Not to my knowledge, but if you do reach out to the resource at www.nurturescienceprogram.org, I can provide you with those. Absolutely.
Okay. Another question. What is the environment in the NICU like? And what can a mom expect?
So again, variable depending on your individual NICU. And this really impacts parents' comfort levels with this emotional expression as well, because we have NICUs that are pods or even individual rooms. Those are the more newly designed NICUs. But then we have open bay units where all babies are all in one room. So the environment of NICU really varies depending on your hospital as well. What I would encourage you is, even if you're in an open bay NICU, where there's other parents and healthcare providers around, what we want to do is make intimate space for you and your baby. If there's a curtain, pull the curtain. If there isn't a curtain, use that mindfulness to pull the imaginary curtain and just have intimate space. It's just you and your baby. When you look in your baby's eyes, you have that eye contact and you start speaking to them emotionally about let's think of a prompt about your pregnancy. I'm going to share with you what my pregnancy was like. And you start looking at baby's eyes, all of a sudden that imaginary curtain is really, really easy to have around you, because nothing else matters.
Yeah, just you and the baby. And another question, how should I prepare once it's time to take my baby home?
So discharge often comes unexpectedly because our babies, they're developing, and as parents, it feels like you're going to be there, like you've been there forever, and but when am I ever going to go home? But once baby starts doing well, it seems to kind of just take off, and baby does really well. So how do you prepare for discharge? Start preparing from the beginning, from day one. Start preparing to take your baby home, so you're not really surprised those last few days when they're like, all of a sudden baby's going home, and you think, oh my goodness, I haven't done anything. Now, as far as the home preparation, baby needs very few things. When babies come prematurely, we haven't prepared the room and done all the things that in our mind we believe we have to do. Babies do not need all of the things that Amazon.com and Babies R Us and all those want to sell you. They don't need all those things. So do not panic if you don't have everything perfectly the way it was envisioned in your mind, or that the media portrays you need. What your baby needs is you. Your baby needs you to be healthy in mind, in body, to be present, and very few other things that the NICU will help prepare you. Bottles that work for your baby, very important. Work with the NICU team, work with the lactation team, work with the feeding team. If you're breastfeeding, You still may have to bottle feed, so work with them for to get some bottles that work, things of that nature. A couple of some clothes and a place to sleep, a safe place to sleep, back to sleep, tight fitting mattress, safe place to sleep. That's what baby needs.
I know we get like so blinded with all the stuff on Amazon and all that.
Yeah.
Okay. How about if I want to get an update on my baby? What's the best time to do that? And can I call in the middle of the night?
Absolutely, positively call in the middle of the night. So many of the NICU moms I work with say, I didn't sleep all night. I thought about calling, but I didn't want to bother anyone. You are not bothering anyone. This is now I'm playing the nurse. This is our job.
Yeah.
This is our job. We are there to help. We are there to give you the information you want. Now, at the same time, we don't want you up all night not getting sleep for yourself, right? But if you wake up in a phone call just to hear baby's doing great or things are the same, if that will help you sleep, then fabulous. Many units now have cameras where you can see baby. Some do, some don't. If you're in a NICU that has that camera system, it can sometimes be concerning because you may see things that you don't understand. Baby's crying, baby may be pulling at their nasal cannula in their nose or something. Please know that the nurses are and the healthcare team are attending to those things. But call if you're concerned, give it a call. But give them a call. But what we found was that sometimes turning that camera off for a few hours at night is okay so you can get some sleep, because if there is ever anything concerning, the healthcare team will call you.
I can totally see that because I think this is already an anxious situation, and I can see how if you have access to a camera, you're going to want to be checking it every 5 minutes and doing that instead of sleeping. So I can totally see why that might be a good idea.
Again, going back to that fine balance, and trying to find that balance isn't always easy. It's a practice.
Yeah, it is. Absolutely. Okay. Do mothers of NICU babies experience more anxiety than other moms? How about dads?
Yeah. So we know that there's an element of giving birth that where all moms are at risk for postpartum depression.
Absolutely.
It's hormonal. So are you at more risk? Yes, because of the nature of what's happening in your life. So yes, are dads at risk for anxiety and depression? Yes, but interestingly enough, we often see it actually in dads when babies come home. They feel they need to be the rock for mommy and they need to be the rock for baby. And then once they get home, that's when we really have to make sure that daddy's getting that support, or daddy partner, whoever the parents are.
Absolutely. It's so important. I think nowadays we're seeing a lot more men speaking up about their mental health, especially with adjusting to being a new father. So it's very important to, as moms, to check into with your partner as well and see how they're dealing with having the baby in the NICU and how they're feeling with the baby going home. So we've definitely seen an increase in that in our program too.
Absolutely. And we have, all families in NICU. So also, if you're adopting a baby, that is in NICU.
Yeah.
Just by virtue of not having given birth to that child doesn't take away the anxiety that you have as parents, being that baby's parents. So we stress it in in every parent.
So Suzanne, that was our last question. I just want to thank you so much for taking the time and speaking with all of us here today. It was so informative. There's so many tips that you gave out that I know for my clients that have babies in the NICU, I'm absolutely going to give that feedback to them. So I thank you so much for this. Before we do end today's Q&A, I do want to talk briefly about our Perinatal Mood Disorders Initiative that's funded by the New Jersey Department of Health. So basically our program, for those of you who are unaware, is broken down into 4 major pieces. The first big piece is we do provide a lot of professional and consumer education. So if there's any of you out there that are interested in us doing like a webinar for your staff on postpartum depression, or for clients that you're working with, we are more than happy to do that. So please reach out to us and we would be more than happy to do something virtually given what's going on right now. The other thing that we do is we do offer support groups that are virtual. You can go to our website at www.partnershipmch.org and click on the link for virtual support groups, and you or your clients can register to whichever one or however many that work and fit with your schedule. And the next piece of our program, which is our biggest piece, is our emotional health phone support program. So if there's any of you out there who do have a baby in the NICU, or a new mom and you're just really struggling with a lot of anxiety or sadness, you absolutely can reach out to us. We would be more than happy to work with you, to talk with you. And if you are interested in connecting to mental health resources, that would be our job to do that for you. So please, if any of you are struggling, definitely reach out to us. We would be more than happy to be a good support system for you while you're going through this time. And then last but not least, we do a lot of community events like this Q&A that we have going on. And we also do a lot of professional education in terms of webinars and in-services and conferences and training sessions and things like that. So definitely always be on the lookout for that. Again, I'm going to end by saying make sure to check out the partnership's website. Again, that's www.partnershipmch.org, and view the virtual support groups for pregnant and new mothers that are currently available. I want to thank you again for tuning in, and just a reminder that this was recorded, and the recording of this program will be available on the partnership's YouTube page. So if you have anybody that you feel could really benefit from watching this, or you want to come back and watch it again, please feel free to do so. Okay, thank you, Suzanne. Thank you, everybody, and have a wonderful afternoon.
Thank you.